Good morning, good morning. What's on my mind? I'm Dr. Dangleben on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel. This is your daily medical tidbit. I just want to remind you, October 4th, which is tomorrow, is Bell Bagay Market in Hollywood, Pointe Michel. So go and support and go and check it out. The topic of today is leptospirosis. Leptospirosis has become a significant public issue in the Caribbean, especially in Dominica, and we have to talk about it. It's considered a zoonotic bacterial disease, zoonotic meaning from obviously the animal kingdom, right? And in that specific disease, it's really primarily rats and dogs, etc., right? And it has really become an issue in the tropics. The illness can range from mild flu-like syndrome to severe life-threatening disease. And when you have flooding, where you have poor sanitation and close contacts with rats and stray dogs, that becomes an issue, right? And the primary route of infection is through urine of infected animals, right? Especially rodents and dogs. And we have both of these issues in Dominica, right? So in context, the transmission occurs when contaminated water or soil comes into the contact of these animals, right? And then into the human, broken skin. It doesn't have to even be a big cut, right? Your mucous membranes, your eyes, and places like that is the portal for these infections, right? So, when you have heavy flooding, heavy rains, hurricanes, right, contaminated water, obviously, is at a higher incident, so you have increased exposure and risk, right? If you do an agricultural work, like banana plantation, you're doing livestock farming, you have a higher exposure rate for leptospirosis. And I could tell you, we have lost a few people from leptospirosis. Mild disease, you could have mild, 90% of the cases is mild. You get fever, you get some chills, you get some muscle ache, right? Maybe a mild headache, and that's it. It resembles the flu, right? But then the second phase is severe disease, right? Where you have what's called pulmonary hemorrhage syndrome, where you bleed into your lungs. You get jaundice, you get yellow, your kidneys fail, and you go into respiratory distress, and you die. Once you get to the severe cases, we talk about 15% mortality if you don't have aggressive treatment. Okay? So right now, countries like Dominica and the rest of the Caribbean have these outbreaks. And it's usually post-hurricane outbreaks, but it seems that it's becoming more ubiquitous. It's just around us now, right? But I think the key is underdiagnosis and even misdiagnosis, right? Because of the symptoms that's presented, right? If you go down the track and you think this is the flu, or you think this is dengue, or this, chikungunya, you've gone on the wrong path, and sometimes by the time you realize it's lepto, patient is in severe sepsis and multi-organ failure, right? So you need good surveillance systems. But these reporting gaps, right, data is missing, we need to do better than that. Once you get into the acute renal failure and your liver failure and you're bleeding into your lungs, it's done. It's too late, right? So we have to be cognizant of leptospirosis and what it means on the healthcare burden in the Caribbean. You got to start the antibiotics early. And it's not big antibiotics. It's the things that we used to, doxycycline, penicillin, things like ceftriaxone, which is third generation cephalosporin. Support the patient with IV fluids. If the patient needs dialysis, move towards that and support the patient through that. And that's the hope of survival, right? We need better environmental control. We need better rat control, right? We need to take care of the dog problems, right? And work on better waste disposal and drainage system. Community education has to be directed all the time. And we have to raise awareness and let people understand that these are the things that's killing the young people. Okay? So that's very, very important. And have doxycycline in stock. All right? Is it a long-term solution? No. Disaster preparedness, like I said, leptospirosis surveillance programs and everything else, put that in place. All right? Now, leptospirosis is a neglected issue, but it's so significant and it's threatening the Caribbean and people are dying. People need to refocus on the priorities of health and what it means. Okay? Get rid of the rats, get rid of the wild dogs, right? Or contain them, take control of the situation, have the appropriate antibiotics and the things that you need in the hospital and the clinic to treat the patient. And we go from there. But education is the key. Have a great day. I got to move. Peace.